It's a pleasure to have you with us, Dr. Prathap Reddy.
Thank you, Navika.
I'm blessed
Wonderful.
to sit across somebody who's pioneered private healthcare in India since 1983. That's a long journey, Dr. Reddy. Tell me a little bit about what made you think about having excellence in the private sector.
First, I think I must wish you happy, the nation. I want to wish happy Independence Day.
To you.
And the Prime Minister's vision for developed nation. I think we should all work for that goal. But in that same context, you must emphasize a little more on health. Prioritize health as that every individual in the world, just not the country. I want to wish the world happy, healthy nation. No.
And that mission has continued for 5 decades, touching 5 decades now.
Right.
What powers you to go every single day that even today you're thinking about Apollo across the country working 7 days a week, on Sundays also, and your tagline, Apollo never sleeps.
Yeah.
What drives this?
I think it's being a doctor. I've been in US for about 10 years, worked in several 2 or 3 states, and saw the healthcare there, and did my fellowship at Mass General in Boston. That all gave me and practice. And I saw the Indian colleagues. They were as good as anybody else, and I think I was as good cardiologist as any of the local cardiologists, or even better. Many people came. So one day I got a letter from my father saying, there are 2 of us who admire what you're doing. I like what you, not admire, I like what you're doing. Me, my mother and him. But if you can do something for people here, how will that be? So my wife immediately said, we must go back. And fortunately, I had 4 daughters who were all under 12, so they couldn't protest.
They didn't protest.
They couldn't protest.
They couldn't protest.
So, I submitted resignation, sold my practice and everything. And then, I spent about 3 weeks in Europe, saw their healthcare facilities also, came back to India. And I saw there was nothing, it was elementary. Compared to the rest of the world, we were far behind. And it was just a few government hospitals were giving, and then charitable hospitals were doing. But the healthcare standards were not available, and whatever that day's technology, that day's care for people was not available. And I'm sorry, I lost a lot of people because this was not available, and they could not go abroad. Because, I sent some, I sent the President, Prime Minister, some rich people all to the 2 years for surgery, being a cardiologist. I had the best setup for cardiology. So who came for cardiology. But cardiology is only one part of heart disease. And when it doesn't work, he needs evaluation. Those days only surgery was available. Unfortunately, there was no acceptable surgical program in the country. So I had to send my patients abroad. And who could go? A small number of my patients would go. And I used to, I was disappointed that the patient couldn't avail those facilities because he couldn't afford it. So one of those days, I had a young man who was only 38-year-old, who was so close. He was with me for almost 4 or 5 years. I used to treat him. One day I told him that, now you need medical intervention, you need surgery, and we need to go back, I used to send all my patients to Dr. Dental Cooley, one of the foremost surgeons then in cardiac surgery. And he was a dear friend of mine. I used to send my case when I was there, so I used to send all my cases to him, including our Prime Minister, Presidents, and all of them went to him. But this man, it was $50,000. Sometimes when I tell him, he will reduce the charges by 10%. Even then, $45,000 he couldn't raise. And it was, his appointment for surgery was in October. On November 9th, in 1979, he came to the hospital in a very almost collapse. And I saw his wife and 2 children. When I walked into the room, I was shattered to see my wife and children. I said, how many more? He passed away, but he's left his unhappiness and a terrible
Families are destroyed.
family started. So that was in my mind, saying, no, we must do it because it happened so many times. So many people who couldn't afford this. Even the facility was not available, even for my own mother. My own mother, when I came back in 1 year, he had CA cancer. But all that was available was surgery. There was no chemotherapy, no radiation, nothing was available. Unfortunately, we lost him. I lost another good friend of mine with a massive heart attack, with a heart attack. But the cardiologist came and he just found out, and the next day he collapsed. Even yesterday, I knew of a person who was 29-year-old, one of our friend's son. They went into his bedroom and they saw he's no more. So he had a massive heart attack in the night. So this is what's happening. So what we need is to bring the facilities. So I said, at that time, and then when I went to the local minister, chief minister, they said nothing can be done there, it's all in Delhi. And when I went to Delhi first, those days, there was a 20,000 rupees ticket. You can travel all over India, wherever you want. I was traveling on the ticket, that was the trip to Delhi. The next time I came to Delhi to change this, bring this transformation in healthcare. And everything was, for example, health is treated as a luxury item. Medical
100% duty on all
300% duty, luxury item.
Okay.
On medical equipment. There was no finance available for
from
healthcare.
banks.
They can give it to hotels, they can give it to even cigarette shops, but not to healthcare. So there are many things which were upsetting. So I said, I want to bring the same facility that is available today in any part of the world. So then fortunately for me, I met General Secretary of Congress on the flight. So he told me, come in the morning to me. Then I went, 3 days I went to Dharmadarshan with madam. On the 3rd day, he said, you want to see me? I said, yes, madam, because there are only 1 or 2% of people who are able to get good health care because either they're rich or your government is sending them.
This was Indira Gandhi?
Indira Gandhi. So immediately the one said, come at 11 o'clock. 11 o'clock, she heard me for almost 1.5 hours of what the facilities are, what we can create, and how can this happen? Only you can do it. Then she called Krishna Rao Sahib, who was the Prime Minister's private secretary. He listened to me for 2 hours, called all the secretaries, Secretary Health, Secretary Finance, Secretary Commercial,
and they sat and...
and he gave them on board. I want you to listen to him and come with a proposal for cabinet decision on Friday.
Okay.
This was on Monday, on Friday. So they all called. The first thing was about the duty. So duty they suggested, they discussed and then suggested, suppose we give you duty free, will you give free treatment? I said definitely, because what I want is facilities for my people. It is not rich or poor, because it is the poor people who are dying. It is the middle class people who are dying. So similarly, if you have to treat the lower class people, I'll be very happy. So I agreed. So they said, first thing that was passed is that. The second thing was the finance secretary. Finance secretary said, we will go through, you come and meet the minister. So I met the minister. He was also convinced that he must do it. But I made 3-4 trips. Finally, he said, we sent it down, we will follow. And then suddenly one undersecretary wrote on that saying, if you are of this, you will be impeached. Because this is not allowed for healthcare, this is only for industry. Then Mr. Venkataraman, he was transferred to defense. Pranab Mukherjee came. Pranab Mukherjee, before that, he gave me cement steel at government quota, 400 tons of steel and so much cement. So that outside it was price is almost 2.5 times. He gave all that. But when he came back as finance minister, on the second trip he told the secretary finance, if you don't do it, you're going to prove that I'm inefficient finance minister of India. He said, what, sir? I said, you will go back to the Prime Minister, and Prime Minister will allot this finance. And then they made me, so he took me by my hand, took me to his room, and typed out a letter saying that I can get 10 crores of rupees from Pi Bank. And foreign exchange importment, I can import with any of the international finance groups. So that was the
beginning.
And in Chennai, there was a land restriction. So I finally bought a palace and
converted it into
turned it into Tiruvankor Palace, his residence. I bought. I turned it around, but halfway through the construction, suddenly the chief minister wrote saying this hotel construction should be stopped. Not hospital, hotel construction should be stopped. So that was another big problem. It took me a few months to convince him. First, he wouldn't even see me. Finally, the Prime Minister, Prime Minister's office wrote to him saying, Prime Minister wants to know by end of this month, what is stopping you to start a hospital, in a good hospital, and why are you stopping it? So that really shook him up. So I was with Sankaracharya in Pune. So, his vision, he says, your work is already done. I said, what, sir? He is not even seeing me. So when I went back to Chennai, then Madras, everywhere there's a news saying CM wants to see you. So next morning it was an April 1st. So I went and saw him. So he said, if there's something we should settle, not go to the Senate. I said, I tried, you didn't even meet me. Anyway, he said...
Who was the chief minister then?
The famous MGR. And so then he took me in his car to the office and signed a thing saying absolute transaction free. So we started, and by God's grace, we had
71 hospitals today.
83. Then President Yeltsin Singh came. But the thing is, even people at that time did not believe that a hospital of this. I remember one remark made by 2 or 3 people saying, Dr. Reddy, you are a very clever fellow. You built a beautiful place to make it a 5-star hotel. I stopped for a minute. I said, what are you saying? I built this for a 7-star hospital. So that was the view. Nobody thought it was possible.
And today, your network has 71 hospitals. You have 6,000 pharmacies, 2,000 touch points.
Pharmacies. Every day, two pharmacies are new pharmacies.
So my numbers
up.
are dated.
Today it's almost 7,000, 8,000 pharmacies.
Okay.
8,000. They're putting up 2 new pharmacies every day. That's the team.
That's the team. And
the action is that you must be able to get for anybody within 1 hour's time there must be a pharmacy. So in India, to go to the to the remote areas and the villages, not easy,
True.
but it's a great help. I come from a small village. There's a pharmacy there.
I mean, to have this vision in 1980s and to be there at 93 years of age, leading from the front, you are truly blessed, Dr. Prathap Reddy. And we are sitting here in Delhi's Apollo Hospital. 24 years ago, I had a premature baby in this very hospital.
Oh, look at that.
And I was told very little chances of survival. And in those days, 24, 25 years ago, you had a neonatal ICU.
I see. Yeah.
And I owe my son's life to this. So for me, this is a very emotional moment to sit across you. And I've gone through it personally.
This is what makes me work for harder. This is what makes the entire 125,000 of poor family members, they see this and they can do better and they do more. It's the compassion. It's that they give to the patient saying, what will I do if my own sister or mother comes? That care, I mean.
The value system.
So it's a God's grace that I would do all this, but I owe everything, my gratitude for this 100,000 plus Apollo family members.
And now you're expanding this even more. You're saying that, Apollo never sleeps, always here. Sundays are going to be, fully working Apollo hospitals. What drives this, Mr. Prathap Reddy, at 93, to be able to push this and have 4 daughters who are absolutely so energetically part of your team driving this? What is the value system that you've given your daughters and your team?
My daughters, I owe it to my wife. I think it's her thing. She made them what they are today.
And not the father? Maybe they grew up...
Father made them work and they loved it, and they saw what father saw, the happiness in people's face, and that gave them the energy. And today they are outstanding things. I'm able to do all of this and much more we're going to do because the third generation is also coming up.
Yes.
So I think this is just the beginning of being on the world-class care for our nation and giving it to the world. But you will see many, many more things happening because always...
Tell me about your wife. How do you think she drove? You are attributing the entire success and learnings to her. 6 decades of togetherness. What does it feel like? What is your love story all about?
She's wonderful. First thing, she was feeling so bad that she has not come on this trip with me. Because
she always travels with you?
Always travels. It's a slight lung infection.
Okay.
So a doctor said, no, it's helpful if you can't. But she was very sad that she can't come. So she calls 3 times a day.
Okay.
So she looks after me completely. And that's how about this. She did the children. Even today the children, he talks to them, brings them closer and closer. And now the grandchildren. So that love she gives, and then what she says makes it whatever they are today. I think I owe a little, but my wife Sucharita made so much difference.
Makes so much difference. I mean, it is...
And they love her. They listen to her completely.
They don't listen to you?
Sometimes.
They don't? Really?
Because they're thinking ahead of me.
They're thinking ahead. That's the thing. Healthcare has changed by leaps and bounds since your first hospital in 1983. AI is the buzzword. How do you see the future of healthcare in India, especially?
I think, previously I used to travel abroad, attend so-called the RSNA, where the new technology is shown for the next year. And by that technology. You see, I'm the first man who brought up a CT to the country, whole body CT. Now there are over 2,500 CTgrams in India. I'm the first one who brought the MRI, first cath lab into the country, full-fledged cath lab. But today, it's all there. So I think the technology, I brought whatever that technology that's available, because what is technology? It is to make the patient, give the more precise, good outcome for the patient. So I never bought the second best. As I said, I'm probably the only purchaser who writes on, when they give an order to the equipment saying, I am ordering this equipment, on the day you install, you must install that day's technology. Like for example, I brought Proton. UK didn't have, Singapore didn't have, all of Southeast Asia didn't have, Australia, Africa, nowhere. Dubai, nowhere. I brought the first city into the country. Of course, I went through a lot. It took them 3 days for the government to give clearance. Then COVID came. So today, there's no place. So much is full. What a third of the patients are from foreign patients. They're all waiting. People go to US and hear about it. They come back from there. And there's one patient who paid money from Bangkok. He paid his money in Mayo Clinic, and then he saw on the phone about Apollo Proton, and spoke to the doctors, and then said, if I come there, when will you give me an appointment? When will you give me the Proton appointment? They said 3 days. So he flew from there, took the money back and flew from there. And then he had his treatment. Every Friday, he is from Bangkok. He had his own plane. Every Monday morning he comes. He used to take his treatment, go back on Friday evening, come back next morning. So this is...
Medical tourism.
Medical tourism. Like that, so many people. Even yesterday, the patient who had been airlifted from California, with CA lung.
And brought here. From California to
From California.
And everybody would have thought that America has better healthcare than India.
So many things. I remember 15 years ago, I had a patient from Minnesota. Because they told him that he's a heart problem, he needed a heart transplant. They said, you are waiting this, you won't get a heart before you die. Apollo is doing heart transplant, why don't you go there, try that. So he came here, then our doctors explained to him, look here, you come, we can do heart transplant, but to get a heart for you, because we must give it only to Indians. If it's not, there's no recipient Indian, he can get it. So his wife came to me and said, Dr. Reddy, I'm flying back to receive his body. And I must look after the business since he is not going to be here. There. So she left. For her, for his good luck, that very same night when she left, there was a heart, there was no Indian recipient. So he received the heart transplant. She came back, she learned how to prostrate. An American lady, typical American lady.
Shashtang, pranam.
Somebody told her, what is the best way to... So she told him, she prostrated and said, this is not hospital. This is, God himself has created this for my husband to get back life. So like that, many people.
And that's what drives you?
That is what keeps me going. That's what keeps me saying, what more can we do? So
there are two things that I want to ask you.
Every year we have what's called strategy meet. The strategy meet is over for this year. I already have 3 other new programs.
Okay.
The strategy will go on. A month later, I have 3 other programs to go on. So we'll come to it, preventive medicine and all that.
Preventive medicine. Yeah.
So like that, I think it's the patients who keep us saying, what more can we do? And
In which areas do you
and
think
then
AI technology is going to?
the most important is we need technology, but we need doctors. So I brought nearly 1,600 doctors from UK, US, Australia, mostly from UK, some couple of hundred from US in the beginning. Now today, we are exporting doctors to US and UK.
How things have changed.
How the whole things have changed. So they made the difference. But others, I knew others can. So we brought in youngsters. Just 3 days before, we celebrated what's called the robotic cardiac surgery. You know, I wanted first cardiac surgery to patients that we have done one of the world's largest number, 375,000 or more. That was 2 months back. Now to probably 280,000 plus surgeries. One of the largest numbers in the world. But in healthcare, it's not the numbers, it's the outcomes. The outcomes are better than the best center anywhere in the world. And over 99% outcome. And costs. That was the reason when I started, no? I started because I used to raise patients because they can't afford to go abroad. The cost that time was $50,000. I started the heart surgery for $30,000. So everything across. Now we put stents. Stent is $100,000 in US. In here we put it for $6,000-7,000. Out of that, cost of the stent itself is for $3,000-4,000. Materials is $3,000-4,000. Hospital and doctors charge is only 2 lakhs of rupees. So this is what we kept it saying. We must be able to, so that more and more people can afford to the
Access to healthcare.
Of the best healthcare, no second best. I don't believe that because you're an Indian, you don't deserve that. We are global citizens, and we must have the very best. Now
Well said.
Now we think we'll not only give it to our people, we'll give it to the world. We're ready to give it to the world. I'll come to that.
Fantastic. But do you think health costs at an inflation rate of 12 to 14% every year is still expensive by the Indian per capita income comparison?
That's why I think we made a big difference. Whatever the doctors, nurses, and everything is different, but there's a good management system, which one of my daughters plays a big role in. How do we save costs without compromising on care? So this is why we increase only 6%, 5%, 6%. And now that I brought insurance in,
Insurance at 1
20
rupee
years
per
ago,
day.
I brought insurance. I still remember when insurance was brought, CI wanted me to call who is who in the world in insurance. She wanted me to chair that conference. So I chaired that conference. At 3 o'clock, I got a call that the bill is not going through. I found out why. Because the Congress government was there. Mr. Chidambaram was the finance minister. Because Congress, there was a conference in Calcutta. So majority of the parliament, Congress members have gone. And he still put the bill because I spoke to Vajpayee, opposition member. He said he'll definitely support the bill. So he said he'll support the bill. So he went to him. He said, I'll support the bill, but I never said I'll support your government. So these people were disappointed. But anyway, it came a few months later. The bill was passed. The insurance is a great help. But I think we need to work out who can say, how can they match the needs of people? Because in healthcare, there's a primary care, there's a secondary care, there's a tertiary care, there's a quaternary care, and technology from an X-ray to proton. So you can't have uniform charges and uniform this one. I think people should understand somehow they feel hospitals should not make money. What do we make money for? Whatever I've done, I went only once for a public issue. After the third year, when my hospital in Hyderabad. I bought a hospital. They gave me a beautiful land in the city in the park. So the commissioner said, if I were you, I won't take that land because it's public property. They'll go into the court. It'll never come. So I climbed up a hill and saw the property and I bought it. So finally, a lot of complaint, the final chief minister cleared the property. So I built a hospital on the top of the hill. You must see that. That's my prestigious hospital. The medical city is called. It's not just hospital. It's a medical city. It's got everything in healthcare, from technology to IT to home care, and 24/7. You name it in healthcare. Nowhere no other hospital chain in the world has got. So that's on the top of the hill, and that's how even this property. You know about Delhi Hospital. Well, first, the Prime Minister wanted to give me the sports hostel next to the stadium to the hospital. So I applied, and I applied with another partner because I was busy with building Hyderabad on the hill because the roads and so financially I had a strain. So I bought a partner. So Prime Minister said, no, I don't want the partner. I want Apollo's name. I want Apollo here. So then I went to the government. So government, for industry, they had a policy. So they will give you the land, they'll give you equity, and once the industry comes up, they come out. So same agreement I made here. So I'm still a partner with them, but because I was busy building other hospitals. So one day, Apollo will use that clause that they would disinvest by 8%, 8%, 8%. So that's how this came. And the LG and the chief health secretary spent almost one day with me in Maurya to convince me. That's how this idea came about industrial thing. So we went to Ministry of Industries and got that agreement and went through. So that's how the IMCL came. Otherwise, I couldn't. I was the government. I'm thanking the governor was so particular, saying, he says, you want Apollo, not your partner. Yeah. And today, it's Apollo in the
And the rest, as they say, is history.
How many hundreds of thousands of people were treated, and how many hundreds of international lectures and symposiums contributing to healthcare for the nation, for our doctors to participate, to learn, to give back. And today we are on par, when our doctors are on par with the rest of the world. When they present at international conferences and our cardiology conference, I talk of cardiology because I'm a cardiologist, but Apollo is not just cardiology.
Yeah,
multidisciplinary cardiology is only 20% of Apollo. 80% is all other wonderful things, like oncology today is foremost. We're probably the best oncology facility in this part of the world, with the proton and what all we do in oncology. So similarly, another transplant in robotic surgeries. But I still talk of cardiology because that's how it started.
That's quite literally close to your
close
heart.
To my heart. So that's why I shake hand a little more with the cardiologist when he tells me that, that patient came last night, and then I did a plasty, he's fine. I believe he knows you. So I go and say hello to him. He's so happy. He recollects, like you recollected 30 years ago. Like they recollect saying, I met you 10 years ago.
You still carry the same excitement in doing new things, Dr. Prathap Reddy. You've been awarded, you've got a Padma Vibhushan, you've got a Padma Bhushan before that, and you've got so many awards and accolades and recognitions.
All this accolade recognition is not for me. It is for all the people who did this. I did not do it, no? I didn't do surgeries. I did not do robotics. I did not do minimal invasive surgeries. I didn't give proton treatment and save cancer patients. I remember a patient came from here. It was an important position. They told that he has only 3 weeks to live. So he told his son, tell Dr. Reddy, I want to die in Apollo. I told the son, give the phone to your father. I said, don't say you want to die in Apollo. Say that you want to get treated in Apollo. So he came to our proton 4 months, 5 months later. He was discharged. We had so many, he had a heart attack during the treatment. He had a gallbladder infection. All done perfect. 5 years now, 5, 6 years, I think he's perfectly well now. In Delhi.
And that's the power
I'm
of
sure tomorrow
medicine.
day after he'll find out that I'm here. And he'll give me a call and say, thank you, I'm fine. You know? You see, that gives me that
Satisfaction.
feeling. And anything, newer things that happens. You know, day before yesterday, last week, one of our doctors came to me and said, "Sir, there's a new thing now I've done today into a pacemaker here. We put a switch here and then put the pacemaker. Sometimes you can get displaced with discomfort. Now, just to the artery, he said, I've put that thing, sir. Patient is absolutely fine. But the thing is, the cost is 20 lakhs. This would have costed him 2 lakhs or 3 lakhs, but the cost is 20 lakhs. But for people who can afford, it's a safer thing. But price will come down. When we start using and it comes to India, price will come down. But the price of that node, initially when they introduced, so everything were there, you know.
Dr. Prathap Reddy, in the end, I just want to ask you, because you're a man who has a vision, a man who thinks big, dreams big, and then achieves it, what is the one mission that you still feel you need to achieve?
I think we have put the seed, the tree has, banyan tree has come. I think we need to continue because, you know, banyan tree gives so many branches. So it has so many other branches. So this is where, as I said, we'll continue to do whatever that is necessary to treat people sick. But our concentration is going to become on preventive medicine. You know why? Way back in the last decade, the World Bank, WHO declared that the world will face with a huge crisis in this decade with what's called the non-communicable diseases. What are these non-communicable diseases? Heart attack, strokes, cancer, diabetes, infection. Now we've added 2 more, obesity and mental illness. This 80% at the end of the day, thing will be people will die from non-communicable disease. Already 2/3 of the deaths are from non-communicable disease. But every one of them is preventable. I told you for cardiac today, we do everything that makes a difference. All that you need to reach hospital. For a stroke, I lost my father from cerebral hemorrhage. Today, no patient will die if he comes to me for some cerebral hemorrhage. The team is everything, the capacity and backup to save him. Cancers. I told you previously when I started, cancer was the death sentence.
No.
Then we said cancer is curable. Now I say cancer is preventable. Cancer is curable, not preventable. Cancer is curable. Cancer is preventable before you do. The other thing which I said I'm going to concentrate is on preventive medicine. You know, way back in 1973, I started what's called the mass health checkup and find out that they have risk factors like BP, sugars and all that. I said to control them so that their heart problems won't aggravate and all of that. I gradually took it, then I made it Apollo health checkup. Today, I've made it as what I call the Apollo who has Zen. You must have that Zen. It gives you a complete...
The annual health checkups that can prevent.
Complete record of yours, including a whole body MRI, all the parts and about 100 tests. So whatever we find out, we know that this is thing, if you neglect it, you'll get a heart attack. If you neglect it, you can detect cancers earlier by screening. You can detect many problems earlier enough. So we can prevent or intervene earlier. Doctors will intervene earlier. Cancer, if you find out. See, in my village, I come from a village. In my village, there are 50,000 people. About 20,000 people live outside. I look after 50,000 people from first breath to the last breath. That means the moment the lady is pregnant, we take care of her. We give her 2 meals a day. When the pregnancy is done, I built a hospital in my father's name. So the hospital will do the delivery. So there is no infant or maternal mortality. Chittor, my district, has one of the highest mortalities of maternal in my taluk, that 30,000 people or 50,000 people. There's no maternal or gender mortality because I look after him. Mother is fed 2 meals a day, and the child delivery is done by our team. And we look after the child for another 5 years. And school, we have a program. And for those who get dropped out, we have
skilling
programs, and they make 15,000 to 20,000 rupees.
What a beautiful way to...
And then there are about 5, 10 to 7,000 people who do yoga and meditation. So I want that to spread. I must say I'm a strong believer in Ayurveda and yoga. I think we need to bring that forward.
A trained doctor saying he is a strong believer of Ayurveda and yoga clearly tells us that prevention is where you are headed. And Dr. Prathap Reddy, for the vision, for the achievements, and still carrying the dreams, you set an example to a whole nation. We all learn something from you, from your life's journey, and from the fact that your enthusiasm continues unabated to literally cross new frontiers every other day. What can one say on Independence Day to such a man, except that we salute you, Dr. Prathap Reddy.
Thank you. This is my promise that we'll continue to make patient first. We have a thing called, my daughter coined the word TLC, tender loving care. We will continue to give the best possible care with that 3 things. The tender loving care.
Which daughter coined
There are
this?
5 things Apollo is known for: clinical excellence, care and compassion, and cost benefit. Cost benefit, as I told you, 10% of the international cost is what we charge. Because more and more people can get an access. So this is why I'm telling insurance, if they can insure and give these various categories of people, different from primary care to quaternary care, if they can fund, many more people will be, it's acceptable. For them to pay 500 rupees is nothing. But suddenly to pay 2 lakhs of rupees for a treatment is difficult.
It's a big deal.
So this is where I am happy I brought insurance into the country, and to insurance today, I think nearly 50% of our patients are, and it's increasing. Every year 5-7% increasing. So hopefully, and Government of India has all that policy.
Ayushman Bharat.
Ayushman Bharat. With all of this, I hope, for people. But what I must tell you is, India is now geared not only to give good health care for the nation, we are now in a position to give health care for the world. The world, you don't know, the world is in a terrible situation as far as health is concerned. Already 150 countries, people come to us. If you look at US today, if you go there, if you want to get a GP, it takes 2 weeks. To get a specialist, it takes another 2 weeks. To get an investigation like an MRI, another 2 weeks. Surgery, another 2 weeks. I give you a small thing. I had what's called sciatica on a Thursday evening. On Friday, because I had all appointments, I took some tablet painkillers, and Saturday morning I went to MRI at 9 o'clock, 7 o'clock. 9 o'clock, all set. 11 o'clock I had surgery. They did that, I forgot that pain. Whereas my own relative in the US, she had the same pain. It took her 2 weeks to get the
Appointment, first appointment.
GP, then specialist appointment. Then surgeon saw. And finally, MRI took another 10 days. Surgery was 3 months. 3 months she suffered. Here, I suffered one day because not because it was not available, because I had so many appointments that day. That is India. And the world will come to you. But what is needed is, I don't know if I must give you about the two things which I took up with the Prime Minister. Can I call them? I will give you later on. I took up with the Prime Minister a couple of years ago, saying that India is now ready to become a global healthcare destination. It is not just 70, 80 Apollo hospitals. There are another 200 good hospitals in the country who are already treating people from abroad and giving the best possible care for our country. I think you must develop, but people don't know. Even Indians in US, when they come here, when they have that problem, and my God, you can never get this in US. So I think if they make it, if the government of India can bring that awareness for people that Indian healthcare is this, it will be a huge thing for the world to be benefited from this.
And for India to become
and
the
for
destination.
India because number one,
healthcare destination.
It's a huge industry. It's about a couple of 100 billion industry. Even if you get 20, 30 billion, it's foreign exchange income. More than anything, it's a prestige that you're treated an American here and you're treated a British person, a European person, an African person. That happiness in the nation should have. The second thing I gave him more, that India, by the end of this decade, the world needs 10 billion, 8 million people, doctors, nurses, paramedics, and all of this. He acted immediately. Wonderful thing is, he saw us with my 4 C-Shaktis. And my wife said, why shouldn't I come? So as he called, and he said, I'll definitely come. So he did speak to me business for 25 minutes. First he said, I like your proposal, everything, but I want to rename it as Heal in India, because way back in 750 BC, Susrata made the first medical diagnostic and treatment. And people came to India till 1250 AD. So I want to call it Heal in India. Then when about the global healthcare destination, he said, I want to call it as Heal by India. That is, Heal by India is, they acted immediately. All ministries got the note. They opened 49 new medical colleges previous year. This year, 11 new medical colleges, 100 new nursing colleges, all other technology colleges. Nursing college, they made admission from 70 to 300. So we'll have additional 75,000 people. And we have now got 300 medical colleges. Nowhere. So it's good for us because first we need more people.
Correct.
Like we need more hospital beds. So we need to develop more hospitals. We need more healthcare people for ourselves. So out of these people whom we train, a couple of million people a year whom we train, we will use 10% of them. 80% of them will go abroad. First, for them, it's good because,
fantastic concept of Heal in India and then Heal by India.
Heal by India. I must tell you another wonderful thing. I have a young daughter. Each daughter, I told you, they're all very special. Preeta does something else. Sunita looks after finance and everything, and manages as MD. Shomna, that's the one who did the 24/7, who made a big difference in
pharmacies.
When we had COVID.
Yes.
20 million people could call 24/7. He'll connect to our doctor. Our doctor will listen to the patient's symptoms and say, yes, I think it's probably COVID. I'll send a diagnostic person to your house. He'll take the test. He'll take the test and then tell, yes, you got COVID, we go to the hospital. Then we found our hospital, we opened 300-bed hospital for COVID. we found that was not enough. Then we took 5,000 hotel beds. So the doctor will determine the symptoms are not serious enough to go to hospital.
Then
You go to the hotel.
yes, those were trying times.
We have a nurse and a home care person. Doctor will come online.
Correct.
And 95% came back from there. They didn't go. They did not go to hospital. So like that, I think there are many, many things. So as I was telling this daughter of mine, she now is tying up with some hospitals in US and other countries. So we manage their care from here. So heal the world from India.
Absolutely.
Heal India, heal by India, Prime Minister. I compliment him for that. And now all ministries, just now also I'm going to meet the ministries on Monday. What each of these ministries can do to take that Heal India program abroad.
Well, as they say, there's one man who's the beacon in healthcare, and he doesn't sleep. And healthcare round the clock is the mission that he carries. Mr. Prathap Reddy, Dr. Prathap Reddy, it's an honor to sit across you and speak with you. Thank you very much for joining.
Thank you. Thank you. I'm very happy. God bless all. Good health.
Thank you. Good health for all.
For the people in the world.